The other thing I just wanted to mention that, you know, all of us might be a little anxious out there. You know, I just want to let you know that the city is well aware of what's going on. We've been very proactive in trying to stay ahead of this in things that we do. There's one here, you'll see how the seating arrangement goes here at City Council. We're doing our spacing and trying not to get too many people together. We've been shutting down certain things temporarily that would have a lot of gathering with a lot of people, just to make sure we can follow the guidance we've been getting from our state leaders and the national leaders, that we might do our part to help curb this virus, get over it. We will get through it. Just use common sense. When you go to the store, just get what you need. You don't need to get a year's supply for the next 2 weeks or this month. You know, there's plenty of people out there. Example, my daughter last week lives up north, calls me and said, "Dad, I went to the store, I couldn't find any diapers." You know, and she was all panicky and all that. So we went down that next morning and went in, found her some diapers and got it to her. So, you know, there's young parents out there, there's young married couples, and there's also the older people out there that aren't used to this. You're used to just going to the store and getting what they need for that day or that week. And so let's be aware of those people and reach out to them and help them. Be good neighbors. You know, be smart, you know, follow with the council. You know, we posted a lot of things online to talk about what we should and shouldn't do. Over the weekend, my wife and I, we went out and walked on the trails and noticed there's a lot of families out there exercising, taking advantage of the beautiful weather. So go out there and enjoy what you normally would, and be conscious of our business owners that have been asked to curtail some of their activities. You can still go through the drive-through, get your food. You know, if a lot of people up here that don't know how to cook, you know, that might still go take care of them. And not pointing to anybody, but it's great. And so just stay calm, and we'll get through this. Now we're going to do something a little different right now. We're going to do a Facebook Live for about 10 minutes. We posted on Facebook that people, if they have some questions about this COVID-19 virus, that they can call in and let us take the next 10 minutes and see if we can help answer those questions for you.
I guess me being the first one up here, I don't have to wipe it down, right? Did someone? Thank you, Mayor. Again, I'm Scott Aylett. I'm the Public Information Officer for Spanish Fork City. And before we jump into some of these questions that we've received, again, we want to reiterate to the public that we're doing our best to communicate to you the updates that we receive, and often the updates that you're hearing through different news agencies and through other local government agencies. We're posting those on social media, on our Facebook, Twitter, and Instagram pages, as well as on our website. And the easiest way to get to that is SpanishFork.org/COVID, COVID-19. And we try and have at least one update a day as it pertains to how COVID-19 is affecting Spanish Fork City. So, and we'll continue to do that as this situation continues to evolve. If we don't get to all the questions tonight, we are planning on doing another Facebook Live tomorrow afternoon. Right now it's tentatively scheduled for 4 p.m. and it'll be another Q&A where we can answer your questions pertaining to the situation and how it impacts us here in Spanish Fork. So I'll jump right in. Kind of the first question that we got is from Camille Jensen. She asked, do you anticipate a complete shutdown of our city? And as we look at the numbers and as we get direction from the state, we recognize that the state of Utah, as well as Spanish Fork City, we're about a week behind the spread in other states in the U.S., but our response is about a week ahead of where they were. And so it's hard to see a good comparison here in the country as to what the spread might be like, considering we're a week behind, but a week ahead in our response. So we're trying to learn from them, and I think that's why the state is being so proactive in some of the measures that they're taking, so that hopefully we have a different response than what they're seeing in some of the other communities. We'll continue to take direction from the Utah State Health Department, as well as the Utah County Health Department, and the COVID task force that was set up by Governor Herbert. So we don't necessarily anticipate a complete shutdown of the city at this point, but again, we'll continue to monitor the situation as we go along. And please, Seth or Tyler, if anyone wants to chime in on any of these, feel free. The next question that we got was from Zolma Farnworth. What does a complete shutdown look like for Spanish Fork? How would expectations be communicated? What would be the process for purchasing things like medicine and food? I highlighted some of the tools that we use to communicate with the public, such as social media, our website. Another tool that we have is our emergency contact tool. It's called Everbridge, which we've used in the past, where you can get an email, phone call, or a text message with emergency updates. So certainly if it got to the point where there were emergency type notifications that needed to go out, we could reach a vast majority of the city using one of those tools. And that's how we would communicate that to the public. In terms of limiting items, a lot of that really isn't the prerogative of the city. Now, we understand a lot of the local retailers are limiting the purchase of items and the quantity of items as part of their policy. And we would expect and anticipate that these businesses will continue to do so. But as far as I understand, that's not really anything that the city would likely get in on in terms of limiting those quantities. Right. As Seth just mentioned, you might not have heard that on the mic. We are in contact with the local general managers for our large grocery stores and club stores, and coordinating with them and getting updates from them as to how they're operating. Lisa and Bill Landreth asked, with people getting sent home from work and not getting paid, what options do you have for citizens that are having challenges paying their utility bills? Mayor, if you don't mind taking a minute to talk about this, we've been coordinating with Mayor and Council on a lot of these issues, and if you could talk a little bit about what we've kind of planned on that.
Right. Yeah. If any of you get sent home or not getting their normal paycheck, or finding out that they're going to be short, when you know that, immediately call our utility staff, and we will work something out with you to make sure that we can get you through this period of time, and then you won't have to worry. But as soon as you find out that you've been laid off, or you're not going to be at work for a couple, 3 weeks, call us. Call the utility staff, and the girls there will work with you, and they'll set up a plan, and we'll make sure you're taken care of. We want everybody to be taken care of.
Perfect. Thank you, Mayor. Let's see. The username was Sherbowl. I don't know your first and last name, but thanks for the question. They asked, are interstates going to be shut down? Will gas stations be closed? Will we have access to groceries? A lot of those questions are really questions for the state and federal government. We, as a city, wouldn't have much to do with interstates being closed or gas stations being closed. President Trump and the White House, they've indicated that some of these critical infrastructure industries should continue to work. They have a special responsibility to maintain that level of service across the country, while also following some of those CDC guidelines. And so again, we wouldn't have much to do about some of those industries there. We spoke a little bit about the groceries a little bit earlier. Celeste Boyce, any word on how pregnant people should be isolated? Are they at risk? Again, some of those more questions specific to whether or not you should be tested or anything like that, certainly contact your healthcare provider, and they would have those answers for you. Terry Holdaway, if we work at, say, Macy's, Walmart, Costco, do you think we should be wearing masks and gloves to protect ourselves and the public? I think we certainly would expect and anticipate that your employer would be working with you as employees to meet your needs, look after your safety as you're interacting with the public. So certainly follow the CDC guidelines that are out there in terms of social distancing and washing your hands and not touching your face. But certainly follow and reach out to your employer if you haven't been given any directives in that regard. Looking to see if we have any other questions that have been coming through. Let's see, Adam Keel, do I still need to return my library book if it's due tomorrow? Adam, you can certainly drop it off if you like. The drop boxes are still open, and we have staff that are working at the library and retrieving those books. We're actually, with the library, something unique that we're doing is we're kind of putting the books into a certain type of quarantine. So as books come in, we're putting them on a shelf for 2 to 3 days because it's debatable on how long the virus can live on a surface. And so we're setting those books aside for 2 to 3 days, cleaning them off, and then putting them back into circulation. So while you don't have to bring it back tomorrow, we're suspending all late fees at this point. If you're out and about and want to go drop it in the drop box, you're certainly welcome to do so. Last question, is there a way to help Intermountain finish their hospital early in case it is needed? Many of the council, I think, in fact, all the council and many staff last week were able to tour the hospital and see their construction progress. As far as I understand, they're planning on being completed this fall still, right? October? Yep. Probably not a whole lot of chance that they would be able to expedite that process forward. But good question. Thank you. So again, to wrap up, if you have questions pertaining to your health, certainly reach out to your specific health provider, your doctor. If you have questions for us, reach out to the city, SpanishFork.org/COVID-19, and submit your questions. We'll have another one of these tomorrow on Facebook Live at 4 p.m. So thank you, Mayor and Council and residents.
Thanks, Scott. Just want to shout out to Scott there. He's been doing quite a bit in the last couple of weeks here with us, and we sure appreciate all he's doing here.